One way to think about this is to think about an Ebola outbreak as something like a fire. And what we have in West Africa right now is like a giant forest fire covering thousands of acres or even thousands of square miles. So this is very difficult to control because of its scale. What we've seen now in Spain, I think in Norway, in Germany, and in the USA would just be a spark or two coming out from this big fire in West Africa. But if a spark lands someplace and makes a small fire, it's easy to put out before it becomes a big fire. So that's one way to think about what's been happening. The reservoir for Ebola is probably certain species of bats. They're not the same kinds of bats we have in the US. And it seems that transmission is not from bat to man, but the bats probably infect other animals such as non-human primates, gorillas, chimpanzees, certain kinds of African deer, and people in Africa who are hunting these animals for food, like we have deer hunters here, may become infected when they're coming into contact with these diseased animals in the field. And once they get infected themselves, they can transmit to others when they are sick. Those different infectious diseases are transmitted in different ways. Tuberculosis, for example, is transmitted through the air. Some infectious diseases are transmitted through food or water, but Ebola does not seem to be transmitted that way. Someone who has Ebola, especially who's very sick, may have a lot of the virus in their body fluids. For example, if they throw up, there may be lots of virus in the vomitus. If they have bloody diarrhea, there can be virus there. If they're bleeding, there's virus in the blood. So transmission seems to be occurring when people come into contact with the body fluids of someone who has Ebola and who is not properly protected with gowns and gloves and masks. What's made this particular outbreak more severe in West Africa are two things. First of all, it was not occurring in a remote rural area, but tended to occur in places with larger populations, including even the capital cities of Sierra Leone, for example, and Liberia and Guinea. So in larger cities, you have a more crowded population with more opportunities for transmission. Second difference is when a disease is occurring in a very remote area, there is little chance that people from there could come into contact with someone from Canada or Mexico or the USA. But the cities where this is occurring now have international airports, so it's possible for someone to be in Liberia one day and to be in Washington or Dallas, Texas the next day. In the USA now, unless you are a household contact and caring for someone with Ebola, or a nurse in a hospital caring for someone with Ebola, you have no chance of getting Ebola at all. And nurses in the hospital, especially after the lessons learned in Dallas, are now taking extraordinary precautions with the full kinds of suits and protections and masks that you've seen on television. So I think the main thing that the public can do is to keep informed, but to keep informed from reliable sources which are promoting facts but not fear. And an excellent web source for that would be at the CDC website, www.cdc.gov.